Hi, my name is Angela Northcutt, and I'm a Doctor of Physical Therapy student at the University of Kentucky. Today, I will be talking about the stages of change and how PTs fit into this model to assist patients with substance use disorder or central sensitization. Motivation assists patients in recognizing the need to change. It assists them in seeking out treatment and being more successful with a permanent change. Recovery begins with the individual deciding why they need or want to change their behavior. Readiness for change indicates the patient's perceived importance of the problem and confidence in his or her ability to change. It indicates a willingness or openness to engage in a process to adopt a new and improved behavior. Readiness for treatment indicates that they are motivated to seek out help and they are prepared to engage in treatment activities. The 5 stages of change are pre-contemplation, contemplation, preparation, action, and maintenance. Motivation, along with identifying which stage of the trans-theoretical model the patient is in, can guide how physical therapists approach patients with central sensitization and substance use disorder. The graphic on the left is a summary of the trans-theoretical model, and the graphic on the right may be a more accurate depiction of how a behavior change occurs. Most people taking actions to modify addiction do not successfully maintain their gains on the first attempt. Each time a patient relapses, they potentially learn from their mistakes. Physical therapists can benefit in this process by educating patients about their condition, the cause of the pain, and using interventions that are appropriate for the stage of change that the patient is in. Patients in the pre-contemplative stage of change have no intention of changing their behavior in the foreseeable future. They also may feel coerced into changing the addictive behavior by a spouse, employer, parent, or the court. The patient may demonstrate change as long as they feel pressure to do so. However, when the pressure is off, they typically go back to their bad habits. During the contemplative stage of change, the patient experiences a sense of concern and vulnerability, leading them to ponder changing their behavior. It typically includes a personal evaluation of the pros and cons for change. They are seriously thinking about changing the behavior, but have not made a commitment to taking action, but they want to within the next 6 months. In the preparation stage of change, patients are committed and are planning to change the behavior. They're planning to take action within the next month. In the action stage of change, the patient is taking specific action to implement the plan they have put into place. They have made modifications to their behavior, experiences, or environment to overcome their problem. This stage is defined as successfully altering the addictive behavior for 1 day to 6 months. In the maintenance stage of change, the new behavior has become normal. The maintenance phase can last a lifetime. Once this behavior has changed over time, the initial decision to change becomes less relevant and it shifts to the benefits of the new lifestyle they have gained. So you may be wondering, as a physical therapist, how you can help. Physical therapists have a huge potential to be support for a patient wanting to change a behavior. People's readiness for change is malleable, and clinicians can help increase patients' readiness for change. The top 3 processes that have been shown to be effective are helping relationships, consciousness rating, and self-liberation. In addition, certain stages have been shown to have better results with specific processes. Individuals in the contemplative stage of change are most open to consciousness raising techniques and dramatic relief experiences. Individuals in the preparation stage use counter conditioning and stimulus control. The action stage, patients rely heavily on helping relationships, and in the maintenance stage of change, development of coping responses without resorting to self-defeating and pathological responses is important, and counter conditioning and stimulus control are effective in this stage. For more information, here are some resources in your quest to helping patients struggling with change. The first link is a Readiness for Change quiz that you can give to your patient. I've also included a few videos to explain what motivational interviewing is, an example of a motivational interview that you could use with a patient, and why motivational interviewing is important. Motivational interviewing is very beneficial to patients, very beneficial to moving patients from the contemplative stage to the contemplative stage of change. Getting over addiction or another problematic behavior is very difficult, but with the tools I've given you, I'm confident as a physical therapist you can guide your patient through the stages of change and provide them with resources to overcome their addictive behavior. Thank you.